sort of feel, you know how people say he needs no introduction, I sort of feel I don't really need to introduce Frank Atherton, because if you haven't seen him on TV in the last 2.5 years, you really haven't been watching, have you? Frank has been front and centre in the pandemic that we discussed as Chief Medical Officer, got a knighthood, made Sir Frank Atherton in the honours programme, and I'm really delighted to welcome Frank. He's been a real advocate for research within Welsh Government and across the NHS in Wales. So, Frank, over to you.
Thank you very much, Kieran. Very kind words. And Prananda, good afternoon, everybody. Really, really nice to see everybody, to see the flock of research world regathering. You know, it's been so long since we've been able to have these sorts of events, and I've certainly missed them. I'm sure you all have as well. So it's great to have everybody back in person. It feels a bit odd to be welcoming you to it because you're halfway through the day, but welcome nonetheless. I think it's the 8th. Is it the 8th conference that Health and Care Research Wales has run over the years, and I always try to get to them. I used to try to get to them. I've missed them for the last couple of years, as I'm sure we all have. So welcome everybody, and it's fantastic to see such a mix of people as well, and that reflects the diversity of our research community here in Wales and beyond. You know, we've got people from the NHS. Obviously, it's nice to bump into some old NHS colleagues and some new ones as well. We've got academic partners, of course we've got representatives from social care, local authorities, local government, voluntary sector, from the various funding organisations, and of course let's not forget the researchers. And I've been enjoying, you know, just during the break there, looking at some of the research outputs that I know you've been sharing as well today. So great to see wide representation and the flock regathering. And I like the theme that you've chosen as well, the where would we be without research. I think that's a great question and a great theme. And when I think about that, I can't help, although I try not to think all the time just about COVID, because it has been all-consuming, I know, for many of us for the last 2.5 years, but I do think about, you know, what research has brought to bear in the COVID world, and I know you've been thinking a bit about that earlier on today, but when I think about the advances that we made, and the fact that, you know, I mean, let's be honest, COVID is still around, it hasn't finished with us yet, we're all sick to the back teeth of it, but it hasn't finished with us, and it's the vaccines, of course, you know, which are helping to keep that link between severe harm and widespread community transmission to a minimum. It's not gone away, but it's to a minimum. And you know, the way that the research world, the research community in the UK stepped up, not least here in Wales, you know, we played a full part in all of this to help develop the vaccines, the therapeutics, which have made a difference to those poor people who are suffering and having to go through ITU and into hospital treatment. So I think we should all be really grateful that we've had the opportunity to support our communities and to really make a difference to people's lives in that way. And of course, it's, you know, that reflects that success reflects the range of talent and skills that we have here in Wales and across the UK, from the bench science through laboratory, through the community, to the bedside, trials work, and of course joining up with our international partners. And so all of those settings are really important to us in the research world here in Wales. So thank you. I mean, I should say that. Thank you to everybody, because I know many of you will have been involved in some of those trials, and you've been pulling that work together. It is not gone unnoticed. It's not gone, hopefully, unthanked. And you know, we have taken some initiatives in Wales, like setting up the COVID Evidence Centre. I know Adrian's here today. He's probably been talking about that to many of you, and the fact that we set that up in the height of the pandemic as a way of understanding what research questions we need to have answered, and the way in which we might answer them, I think was very timely and very effective for us here in Wales. So it's a great example of investing in research at the time when we needed to. So thank you. Now, the context, as I say, is still that the virus is still with us, sadly. So it's not all about COVID now. We need to get back to some of the research work that we've been doing and that we were planning COVID. It is still here. It's still going to be a key component of our research agenda going forwards, but the focus really has to shift from the acute work, vaccines and therapeutics, to recovery, the questions around long COVID, the questions around how we live with COVID going forwards are really important to us. When I think about, the question of where would we be without research, I try and take the eagle-eyed view, and my thought goes to, well, what are the benefits? And I have to kind of be able to articulate these very clearly to ministers, who do take a bit of persuading, not least when money is in very tight, very short supply. That research is really important. And of course, I know I'm speaking to the converted here, but the benefits to me as a clinician, as a public health doctor of research lie in the fact that it leads to better quality of care. We know that organizations and systems which are research focused have a far better ability to attract good quality clinical staff, good quality clinicians, and to retain those staff as well, of course. And we know that organizations which are research focused have better outcomes for patients. Ultimately, it's good for patients, it's good for the system. So I have no hesitation in trying to make sure that our ministers understand that is the environment that we work in. But we have to recognize, I think, that the research environment, in the UK generally and probably globally, is changing. As we've come through the pandemic, we've recognized the need to be flexible. We've shifted resource to where it's been needed. The COVID Evidence Centre was a good example of that, perhaps. But some of the work that we were doing, some of the research which we were planning and which you were implementing pre-COVID, I know it's going to be difficult to complete it because COVID has had an impact, a negative impact on recruitment and on some of the trials, and some of them hopefully will get back on track. Some of them may not and may need to end early. And it reminds us that we need to constantly keep a view on the priorities around research and to refocus our priorities when we need to. Another of the kind of major shifts really that I've seen really through my professional career, I suppose, and it's a continuing shift, is away from single-center studies towards multi-center. That's not to say that single-center studies have no place, but by and large, the direction is to move to greater collaboration. And again, that's another of those things which we should have learned, we must have learned through the COVID times, which is that collaboration is the only way to proceed. Collaboration among ourselves and collaboration, of course, with the people who matter most, our patients and our communities. So what have we learned over the last 2.5 years? We've learned that we can be more efficient. We need to be more efficient. We need to be flexible in our research efforts. We have learned that we need to be collaborative. We need to work together. And when I talk about that, I mean collaborative here in Wales, but also collaborative beyond the boundaries of Wales. Certainly the COVID work I've described was multi-nation, not just in the UK, but beyond the UK boundaries as well. So we need to look within about how we strengthen our research capacity and ability, but we also need to look without as to how we strengthen our collaborations. And really importantly, we need to look to the public, to our communities, as to what their priorities are for research and how we can address those. There's no shortage of priorities, of course. The minister will have her own priorities, but we need to weigh all of the different priorities together. So finally, where do we go now? As I mentioned, budgets are quite tight. We did manage last year to increase the research and development budget in Wales slightly. It's now about £47 million. It's not enough. It's per capita. It's less than other UK nations spend. And to that degree, I sometimes feel that we're, architects of our own misfortune, that we don't manage to attract enough funding from outside. If we look on a per capita basis compared with other nations, we're not attracting the research funds we deserve. And we need to turn that around. We don't want to rob Peter to pay Paul, but we need to make sure that we get a fair share of the research available research funds here in Wales, so that we can continue our mission to strengthen research and to strengthen outcomes for patients. So my ambition is that we will continue to punch above our weight. We'll try to redress some of those imbalances that we have, that we will continue in Wales, within Wales and beyond the boundaries of Wales, to build those partnerships which will lead to effective research which has better outcomes, or at least better outcomes for patients. And we will continue to lobby at UK level for increased resourcing and for a better share of the overall research and development cake which the UK has available to it. So that's really all I wanted to say. I hope that you have that the rest of the conference goes very, very well. I think we do have, and just looking around the room, you know, it's apparent to all of us, I'm sure, that we have a thriving research community here. I want that thriving to continue to grow. I want us to be able to attract and retain the best staff in Wales so that we get good outcomes for patients. And I want better outcomes for those patients. That's really what we're looking for. And research has such a huge contribution to make to all of those agendas. So good luck. Thank you very much. And it's great to see you all here in the room. I look forward to hearing more about the ongoing deliberations. Thank you very much, Kieran.